On behalf of Indian Chamber of Commerce, I would like to welcome you all to this webinar on role of physiotherapy during COVID-19 care. I'm really happy to welcome all the subject experts present here today to make us aware of the importance of the topic in more details. We are especially thankful to Dr. Richa Singh Devgupta, Senior Vice President, Fortis Hospitals, and also co-chair ICC National Healthcare Committee, Madam Tania Ghosh, Suraj, Dr. Tamina Islam Amin, MPT, Neuro, PhD, consultant, physiotherapist, and last but not the least, Mr. Ranendra Ojha, Head Marketing and Commercial, Suraj. To set the tone of the discussion, I would like to make few brief points on this subject. Although the topic is relatively new and less talked about, it's very important in treating COVID patient is getting prominence with a fast pace. Hence, we think there is a genuine need to make people aware about the relevance and importance of physiotherapy in COVID care. As frontline practitioners, physiotherapists often come into direct contact with patients that are infected by this virus. Hence, they have a huge role in identifying, containing, mitigating, and treating the symptoms of this disease. This includes implementing methods to reduce the transmission of COVID-19, initiating early identification strategies, and dealing with identified cases appropriately in the clinic and home environments. They also play a fundamental role in multi-professional teams providing ventilator support during the acute illness phase. So with this, I want to close my remarks. I hope we all will be able to know more details about the subject throughout the ensuing discussion. Thank you very much. So now I would request our co-chairman, Dr. Richa Singh Devvarma, Senior Vice President Fortis, co-chair ICC National Healthcare Committee, to kindly deliver the special address. Over to you, madam.
Thank you, Ms. Madhuparna. I'm glad that ICC on regular interview is organizing such talks. So I remember that a couple of weeks back, we organized something which spoke about the mental health of people during this COVID times. I think all who are present on this platform, they would agree with me that this COVID, which has been going on for almost 1.5 years, this pandemic has had disruptive impact on all of us in all sphere of the life, whichever sector you talk about. And particularly when we speak about healthcare, hospital people, frontline workers, they are the one who are bearing the brunt, absolutely facing it at their end in terms of treating those patients. So what is important, as we say that, everything which has so many things, so many disruptive impact on us, always there is a positive side to everything. So when I look at this pandemic, one positive thing which I can surely point out is the digital health, the way we have actually quickly adapted to it. So whether I talk about teleconsults, whether I talk about measuring your own parameters, especially in case of the chronic patient, and keeping a record of that and constantly sharing it with your doctor and trying to keep yourself in the equilibrium of good health. So there are certain things which is happening, and while I was interacting with Mr. Ojha before the session started, I was glad that this new organization, new company has been formed which deals with the digital health. And particularly the topic which they have chosen for today is the impact of physiotherapy in COVID care is something which really excites me, because as Ms. Madhuparna said that not much has been spoken about this subject. While we have spoken a lot about the organ that it impacts, especially lungs, but very few know that there is a huge role of physiotherapy when you have to get back to track. You have to bring back that person who has lived in ICU for a long time trying to get out of this situation, and how a physiotherapist plays a role in getting that person back on his feet, his or her feet. So with that, I think I would now invite Ms. Tanya Ghosh to talk about the subject and her company in particular.
Okay, thank you. Thank you so much, Doctor. So, from SureRight, I would like to welcome you all in today's session. SureRight is basically a one stop healthcare app. Our main aim is to smoothen the healthcare services in India. So the services that we are offering as of now includes doctor appointment, like you can book doctor appointment through our app. We have our own pharmacy. You can get discounted medicine from our pharmacy. We have tied up with a lot of diagnostic centers. You can get diagnostic tests booked from our app in a low rate. We have a wellness store wherein you can buy any health related product. We have ambulance services, we give home care services, and also hospital admission. So, as we know, today's topic of discussion is the role of physiotherapy in COVID care in COVID times. So, for that, I would like to invite Dr. Tamina Islam, consultant physiotherapist. She has a clinical expertise of more than 2 decades. She has been in the most premium hospitals across Calcutta, in Woodlands and Apollo for a long time. So, I would like to invite Dr. Tamina Islam to speak on today's topic. Over to you, Doctor.
Yeah, thank you, Tanya, and good evening, everyone. I'm Dr. Tahmina, and today I'm going to talk about the role of physiotherapy in COVID-19. Now, COVID-19, as we know, had been a global pandemic, which has affected the whole world. And as we know, that it is the main organ which is affected by COVID-19. The primary organ is the lungs. So lung being the primary organ and being, as we know that each and every lung is made up of millions and trillions of alveoli. So these alveoli are the main respiratory unit of these lungs. So to keep a lung healthy, we'll have to keep these alveoli open, and thereby the lungs would be functioning absolutely healthy. But what happens if COVID-19 infection happens? So with the COVID-19 infection, all these alveoli, they generally collapse. And that is the reason all the complication starts thereafter. So once we are infected with COVID-19, then pulmonary rehabilitation is mandatory. And here comes the role of physical therapist to take care of the cardiopulmonary system. We need to focus at the alveolar recruitment strategy. Now, what is this alveolar recruitment strategy? This alveolar recruitment strategy starts with the deep diaphragmatic exercises, which is the mainstay of keeping our lung healthy. Now, in this deep diaphragmatic exercises, we all know that we have been doing yoga and all. We do like Surya Namaskar, we do pranayama. We all say that we do yoga every day and we do pranayama every day. But are we engaging this diaphragmatic muscle to improve our lung function? If we are not doing that, we should start doing it today, because the absolute 100% recruitment of the lung function will happen only if we can incorporate all these alveoli together. And that will happen only through deep diaphragmatic breathing. For the deep diaphragmatic breathing, we take, how do we do that? How do we go about it? So we take a deep breath through our nostrils like this, almost say for 3 seconds. We hold it for 4 seconds and then gradually leave our breath slowly through pursed lips. So the expiration should be for almost 6 seconds. That is, the expiration time should be double that of the inspiration time. That is very crucial to keep our lung alveoli open. That is our main function. Now here we'll have to take care of 3 things. Firstly, we are doing a diaphragmatic breathing. So we are engaging the diaphragmatic muscle, which is the main respiratory muscle of our respiratory system. For the absolute lung functioning, 100% lung functioning, we need to engage this diaphragmatic breathing. So diaphragm is the main respiratory muscle, which has to be engaged with the deep diaphragmatic breathing. Along with that, we are doing the breath hold. So in this breath hold technique, suppose we are breathing in for 3 seconds and we are holding for 4 seconds. With the breath holding technique, what happens is that it helps to open up these alveoli, which have collapsed because of COVID-19 infection. And after that, we are doing an pursed lip breathing technique. In this pursed lip breathing, what happens is that our respiratory rate can be controlled. Now, most of us suffer from, if we are having COVID-19 infection, they suffer from breathlessness, they suffer from shortness of breath. The shortness of breath can be controlled through pursed lip breathing. We can reduce the work of breathing, we can reduce the respiratory rate, we can reduce our breathlessness, and at the same time, we can also improve our blood pressure, we can also improve our anxiety through the pursed lip breathing technique. So that is the reason taking care of all the three factors, diaphragmatic breathing, breath hold technique, and pursed lip breathing, we need to take these deep breaths every 1 or 2 hours whenever we are awake, if we want to fight against COVID-19 in the milder cases to the severe forms. Now, what happens in the severe forms is that, like, along with this, there's patchy involvement in the moderate cases as well as to the severe forms. There's patchy involvement of the lung. If we can see the CT scan, if we can see the X-rays, we'll see that there's patchy involvement. There's consolidation in the lung with the patchy involvement. It's become whitish in the X-rays and CT scans. So that shows that there's consolidation there. The alveoli have collapsed there. So we'll have to recruit these alveoli so that our lung capacity, our lung volume increases. For that, again, we can use the maneuver, that's segmental breathing. Segmental breathing helps us to focus in those particular areas of the lung which are being infected by COVID-19. There's patchy involvement in the lung. So for segmental breathing, as we know, that lung is made up of various segments, various lobes, like our right lung has 3 lobes and our left lung has 2 lobes. So we get into the segmental breathing if we want to emphasize in particular lobe of the lung. We can do that by using our own fists. We have our fists which can be placed underneath the collarbone like this. And once we are taking a deep breath, we breathe out, we hold and we breathe out. When we are breathing out, we try to pressurize downward like this. Breath hold, we breathe out through pursed lips. And when we are doing that, while expiration, we press it downward like this. This is the apical breathing, which helps to open up the alveoli of the upper lobes, which are involved. Then we come to the lateral costal breathing, in which we try to focus in the lateral side of the lung, where we'll have to hold along the rib cage towards the side. So it's something like this. Along the rib cage at the side we hold, and we take a deep breath. Then we try to squeeze in the rib cage laterally. So that's how we can incorporate the lateral alveoli, which are located towards the side of the lungs. We can recruit them through the lateral costal breathing. And then finally, we want to emphasize the diaphragm. So for the diaphragmatic breathing, once again, we'll have to clasp our hands like this and put it where the rib cage ends. And that is the diaphragm. It's a dome-shaped muscle which separates the upper thorax from the abdomen. So the rib cage, where the rib cage ends, the diaphragm is located there. We'll have to use a clasped hand and put it where the diaphragm is there at the base of the rib cage. And once we take a deep breath and we try to release it, we put the pressure inward and upward, like this as we release. So these are the 3 methods of segmental breathing which can be used to emphasize in certain areas of the lobes if we want to address specifically in that particular area. So segmental breathing is very effective in case of patchy involvement of the lung, which very commonly happens in COVID-19. So deep diaphragmatic breathing, segmental breathing, along with that, another very common therapy which is used is the incentive spirometer. It is something like this, a tri-ball incentive spirometer, which gives an added visual feedback for how much is our lung capacity. For this, once again, we put the mouthpiece in our mouth and we take a deep breath. We inspire a deep breath like this. Again, we try to hold the balls above and then slowly release. So once again, it gives a visual feedback. Like when it's a blue ball going up, it's 600 cc. If it's yellow ball, which is going up, it's 900 cc, and the green one is 1200 cc. That's for absolutely normal lung. We'll be able to lift all the three balls together. But with COVID infection, this would be difficult. This is mostly for the milder cases to moderate cases. But if it's an acute phase where the respiratory involvement is too much, they won't be able to do this flow incentive spirometer. For them, we need to where the oxygen requirement is almost like 4 liters. There we need to incorporate the volume-based spirometer where we have a piston. The same kind of visual effect would be there, but we have a piston and it requires less work of breathing. So that's why that is easier for people who are in the acute phase rather than this flow incentive spirometer, which is mostly for the mild to moderate cases. So these are the things which can be used, incorporated in COVID-19 conditions to improve the lung function. Now, along with that, we also have acute and active cycle of breathing technique. In this active cycle of breathing technique, if we have some kind of congestion, so we have secretions accumulated in the lungs, along the wall of the lungs. If we have secretions accumulated along the wall of the lungs, then we need to clear our airways. Otherwise, the collapse, how will we take care of the collapse? So first, we'll have to remove the mucus from our lungs. So to remove the mucus, what we need to do is that first we'll have to take few deep breaths, say 3 to 5 times. Followed by that, we do a huffing maneuver 2 to 3 times. For huff, what do? We take a deep breath through our nostril and we do a forceful expiration through our mouth. Like that. This is the huffing maneuver. In huffing, what are we doing? We try to, whatever sputum is accumulated to the walls of the chest, we try to take it from the smaller airway towards the larger airway, towards our trachea, followed by a forced expiratory technique, which is coughing after the huffing. So we do 3 to 5 deep breaths, then we do 2, 3 huffing maneuver, followed by coughing, so that all the secretions which are there, all the mucus which is there accumulated to the chest wall, first comes from the smaller airway to the larger airway, that is the trachea, and by the means of coughing, we can easily expel it out of our respiratory tract. We expel it through our lungs and thereby try to keep our lung airway clean, free from mucus. Now, while doing this, we can also take help of steam inhalation. Now, when it comes to steam inhalation, it has become very trendy these days. Everybody is doing steam inhalation, whether they have any symptom, whether they do not have any symptom, everybody is doing steam inhalation. But according to the Center of Disease Control and Prevention, till date, there's no scientific proof which has shown that steam inhalation can help to prevent or kill coronavirus. So until unless we don't have any kind of congestion, as we were talking of the sputum and all, which is there in the lungs, if we don't have any congestion in the lungs, or if we don't have any kind of congestion in our upper respiratory tract, or there's no congestion in our nasal tract, there's no need of steam inhalation. Rather, steam inhalation might cause you some kind of ill effect. It can cause you burn in your, like alveoli are such delicate structures. Our cilia, starting from the cilia, which is present in our nose, from where we start our inspiration to our alveoli, which is there deep down to the lungs, all are very, what should I say, very delicate organs. So these delicate organs, if we are doing excessive steam inhalation 100 times a day, as people are doing these days, it's become so much of trend that everybody is doing steam inhalation, whether they have any symptom or they do not have any symptom, they also are doing. But if we are doing in a wrong way, the steam inhalation, without any symptoms, it might even damage these delicate structures. So we'll have to be very careful while doing steam inhalation. But if we don't have any symptoms, then steam inhalation is of no use at all. So that we'll have to take care of. That steam inhalation is only required and is only useful if we have any symptom. Otherwise, it's of no use at all. So steam inhalation helps if we have congestion. It helps to loosen the congestion. Along with that, we need to use certain manual therapy techniques. In manual therapy techniques, what do the physios use? They use their own hands. We use cupping maneuvers, which is also called like percussion. We try to percuss our lungs, like we use the cupped hand and we try to percuss it over our lung throughout, starting from the top to the base of the lung, where the rib cage ends in the front as well as at the back. So this sound which comes, that is percussion. So we do something like this to loosen the secretions even further. Whatever loosening has happened through active cycle of breathing technique, through steam inhalation, it is enhanced by doing these manual therapy techniques, which is done by a physical therapist to loosen the secretions if there's any secretion in the lungs. And after that, we do a postural drainage. In postural drainage, we take use of the gravity, and depending upon the lobe of the lung which is affected, that remains topmost, and we use the effect of the gravity to pull out all the secretion from the lung very easily. Now, when we talk of postural drainage, another very common terminology, as it was mentioned by the doctors earlier, proning. Now, this prone position, what is this proning? Prone position is nothing. It's a therapeutic position being used by the physical therapist for years and years. And now all of a sudden with COVID, it has become so popular these days. What is proning actually? Proning is nothing but a position in which we make the patient lie down upside down. That is, we make the patient lie on their tummy with proper support of the different structures, different joints. We need to support it with proper pillows so that they don't hurt at any joint, whether it's in the chest or underneath the hips, underneath the knees, wherever the patient is hurt, they are giving pillows to position them properly in a prone position, that is upside down on their tummy. Now, what is the advantage of this proning position? This prone position helps the patient to get proper oxygenation to the lung. Now, we need to understand that the whole day we are lying up, like on supine position, like lying on the back like this. So when we are lying like this in the supine position, the lung alveoli, which are completely pressed underneath, which are there at the back, they're in constant pressure of the back and they are being collapsed because of this position, faulty position that we are lying the whole day on the back. So they are most vulnerable to get collapsed because of our position. So what we do is that we just do the reverse. We make the patient lie upside down like this. And thereby what happens is that the alveoli which were collapsed at the base of the lung, they open up because of proper oxygenation, and thereby the ventilation perfusion mismatch, which was happening because of the abnormal or because of the faulty position because of the supine position lying continuously on the back for a prolonged period of time, that is taken care of. This ventilation perfusion mismatch is taken care of if the patient lies on the tummy instead of lying on the back for a prolonged period of time. Now, for how long can a person, most of my patients will be asking me, for how long can we be in the prone position? Should we be in the prone position for the whole day? No, we cannot be in the same position for more than half an hour to 45 minutes at the max. If we are in awake proning, for mild to moderate cases who are at home, they are in home quarantine, we can lie down in the prone position, but we should not be lying down for more than half an hour to 45 minutes because the disadvantages of proning also comes into play if we are lying down for a prolonged period of time in the same position. Firstly, it's the neck. If we are lying in the prone position for a prolonged period of time, we either need to keep our neck to the right or to the left. So if we are keeping it like this for more than half an hour or 45 minutes, what happens is that the neck muscles might get strained, which is very common in a proning position. So every half an hour, we need to change our position. Along with that, another disadvantage of proning is venous stasis, by which I mean there's circulatory imbalance which happens because of continuous prone position. We need proper circulation, which goes into stagnancy or status because of prolonged proning position. So that has to be taken care of. Along with that, another major difficulty in prone position is our diaphragmatic breathing is jeopardized. our cuff reflex is hampered. We cannot do that comfortably. The contraction of these muscles are hampered because of proning for a prolonged period of time. So proning is good, provided we follow the protocols of half an hour to 45 minutes. But definitely if the patient is in the ICU or any kind of ITU setup, now with the machines, like if they are intubated in the ventilators or they are in ECMO machines, it's not possible to change the position every half an hour, 45 minutes. Then we need to train or educate the nurses there. We generally do that so that they change the position at least every 2 hours to 3 hours. But at times, because of the shortage of manpower, that is also not possible. So we train them to change at least the neck position every 1 hour. If they are in the right side, to make it towards the left, so that the compression on the neck, as well as the brachial plexus muscle. Brachial plexus injuries are also very common. If the neck position is like this, it strains the brachial nerves, which is coming out from our neck, the cervical region. We need to take care of that. So that's why at least the change of the neck position is very important while being in the prone position. And the sisters, we generally educate the sisters about that. We educate them about the brachial plexus injury, because if we are in the prone position, our nerves can get pulled, and since the patients are semi-conscious or unconscious, they don't realize that they are getting injury at the brachial plexus. So it is the duty of the people who are all the medical health professionals who are around them to take care of the brachial plexus injury. To prevent that, we position the patients properly. We keep the abduction of the shoulder like this. We keep the shoulder abducted to almost 80 degree and the elbows are bent to 90 degree. It's like this. It's like this. In this position, if the patients are kept in prone position, then the pressure on the brachial plexus reduces, and thereby we can reduce the risk of brachial plexus injury. So that's very important and needs to be taken care of in the ITU or the ICU setup. Along with that, once we are making the patient prone, how we are making the patient prone, that is also equally important, because with the slightest of the change of the position, we have seen there's hemodynamic stability, instability, which happens. We need to take care of the hemodynamic stability. By hemodynamic instability, I mean that slightest change of the position can make the patient increase in their heart rate. The heart can go into cardiac arrhythmia. Irregularity in the beats can happen because of the proning position. So we'll have to be very careful while making the patient prone. So we need to take care of the hemodynamic stability. While doing that, we should see the monitor. We should check for the saturation. The saturation should not drop by 3 points when we are making the patient prone. That's essential. That's equally important, needs to be taken care of. At no point of time we should be doing anything which jeopardizes the hemodynamic stability of the patient. If we cannot prone the patient in that kind of situation, we can be happy with making the patient semi-prone position, if not prone. We should try to make the patient first in the semi-prone position, and then we can make the patient into right lateral, left lateral, whatever suits them, but at no cost we can jeopardize the hemodynamic stability of the patient. That is very important, needs to be taken care of by all the healthcare professionals who are working with the COVID patients in the ITU and the ICU setup. So that's very important to be noted, that we need to maintain the hemodynamic stability. So maintaining the hemodynamic stability, if we can make the patient prone and we keep changing the position to the right lateral, to the left lateral time to time, we can definitely take care of major complications which happen because of respiratory insufficiency. So the alveoli can be recruited. It's one of the major positions, which is therapeutic position, which is used for the alveolar recruitment and definitely helps in these kind of patients. Now, along with all these positioning and the different breathing techniques, the airway clearance techniques, another very important system which needs to be addressed by a physical therapist is the musculoskeletal system, because 20% of the muscle mass goes in just 7 to 10 days. We lose our muscle mass in just 7 to 10 days. And we are in home quarantine for almost 14 days. We can very well imagine what happens to these ICU and the ITU patients who are there for month after month post-COVID. They are in ventilator, they are in ECMO machine. What happens to their musculoskeletal system? So much of deconditioning happens by the end of the a discharge, we cannot imagine. And as I said, 1 week is enough to cause muscular atrophy. which is very common. We lose our muscle mass very easily, especially the quadriceps and all. They just lose in 1 to 2 weeks. So we need to condition our musculoskeletal system, and physiotherapists, being movement experts, have a major role to play in this situation. So we start with if the patient is in the ICU or ICU setup, or if the patient is homebound also, we start with the flexibility exercises, the range of motion exercises, because of prolonged immobility. If there's prolonged immobility, then definitely the chances of muscle contractures are there. So we need to take care of the muscle contractures by proper range of motion exercises. So when it comes to range of motion exercises, if the patient is not able to do themselves in the ITU setup or the ICU setup or the high dependency wards, then we need to help them doing the passive mobilization, passive range of motion exercises, where the therapist does it for the patient, because the patient is not in the position to do. So all the joints are being mobilized passively by the therapist. So whether it's upper extremity, lower extremity, all the joints are being mobilized. Along with that, we need to take care once again of the hemodynamic stability. We should keep monitoring while we are working on the patients. We should keep monitoring so that we do not desaturate the patient to any extent. That has to be taken care. So once we start with the passive mobilization, if the conditions are better, if the patient is improving, we go to the active assisted exercises, whatever the patient can do. And after that, it has been guided or assisted by the physical therapist in maintaining the range of motion, like full range of motion, like it starts from the shoulder, then the elbow, all the full range of motion exercises, whether it's the fingers, whether it's the wrist. That helps to prevent the contractures and deconditioning in the patients. So from passive to active assisted to active, the patients who are homebound, like in home quarantine, they can do actively. But once again, they should take care of the saturation, whether they should keep on the pulse oximeter while doing the exercises, or if they are using the oxygen, like if they're needing oxygen, 1 to 2 liters of oxygen generally is required in the initial phase. So they should increase the oxygen by at least 1 grade. So it should be, if they are taking 2 liters of oxygen before exercising, they should make it 3 liters of oxygen, and then they should do the range of motion exercises or whatever exercises they are doing. And after that, again, they should settle it to whatever oxygen level they were used to. So that will take care of the hemodynamic stability. The pressure on the cardiorespiratory system would be taken care of by increasing the oxygen level to some extent. So that is one point to be taken care of. And along with that, once we are better, the patients are better, we start the mobility at the earliest, because that is our aim. We start the earliest mobilization of the patient for a better output of the patient themselves. So earlier mobilization, we start with the bed activity, with the bed mobilization, like turning from right to left, left to right, and then gradually sit up to the edge of the bed, whether it's supported, unsupported. Gradually, we'll have to work on that. Sitting up at the edge of the bed, doing some quadriceps drill, like dangling of the leg there at the bed edge, then making the patient from sitting to a standing posture, and then standing with support or without support. We gradually follow the same regimen like this in doing the functional activity. So we need to assess functionally what the patient can do, what the patient cannot do, and accordingly we need to follow all these maneuvers, like sit to stand, standing, and in standing, if they are having any kind of balance problem, like if they are having issues with the balance, we start with the balance training. That's how the rehab continues. Like whatever is the problem, we try to address the problem then and there. We start with the breathing exercises, as we said, the cardiorespiratory system we are addressing. Along with that, we address the musculoskeletal system. We start with the passive range of motion exercises to the active assisted range of motion to the active range of motion, followed by the bed mobility, the functional training. From the functional training, we move on to balance training. In balance training, we make the patient do with support or without support, standing on toes, standing on one leg, and then we increase the challenge by making the patient walk along a straight line, or making the patient walk along a circle, figure of eight. So gradually it all comes into play as the patient's condition improve. Along with that, another very important aspect is whether what is the level of fatigue of the patients. If the patients are getting fatigued, then again we'll have to pace the activities. We should try to pace the activities by giving them breaks. We can reduce the intensity, we can reduce the frequency of doing the exercises depending upon the patient condition, because each and every patient will have some particular problems. We need to address the problem So the exercises have to be customized. It cannot be a general exercise for everybody. These are the parameters, these are the regimens which needs to be followed. But again, each and every individual do not follow in the same, they do not fit into the same pair of shoes. The same thing, we need to tailor or we need to customize the exercise program for each and every individual depending upon the condition and the status at that point of time, and needs to be continuously assessed and accordingly needs to be improved. That has to be taken care of. So along with the musculoskeletal system, as we were addressing, with the respiratory system and endurance training for the fitness, as we were talking about fatigue, we need to work on the endurance training as well as strength training. For endurance, as we said, that if the patient is a little better, we can start with 1 minute walk test. We put the pulse oximeter in their hand and we ask the patient to walk slowly at their own pace and see how much the patient is able to do for how many minutes. If it's 1 minute, 2 minutes, and then gradually we progress for 1 or 2 days, maybe they continue with the same pace and gradually they improve. We check for the oxygen level, and wherever it's dropping by 1 or 2 points, we make the patient sit there. They are asked to take deep breaths and gradually do certain exercises like shoulder circling and all in that position, little bit of movement of the upper extremity or little bit of movement of the pectoral muscles, which are the accessory muscles of breathing. These exercises, while being in a paced position, will help them to improve their endurance. So endurance training is very important, which we do by this 1 minute walk test, 3 minutes walk test, 6 minutes walk test, depending upon the condition of the patient. And that's what tells us that the patient is improving. And along with the endurance training comes the strength training. The muscle weakness is there. We have taken care of the flexibility, the functions, whatever they are able to do, the balance, the gait, everything. But the strength training also has to be incorporated in the long run, for which we can introduce these kind of TheraBands. The least resistive TheraBand is the yellow TheraBand, the tan TheraBands. These are very effective in strength training. And since the muscles are so weak, we can start with the eccentric strength training. In eccentric strength training, it reduces the load on the cardiorespiratory system by almost 80%. So the taxation on the cardiorespiratory system reduces by 80% in eccentric strength training. In eccentric strength training, we start from the mid position like this, and then we try to lengthen the muscles. We try to lengthen the muscles like this. We do not go to the complete contraction of the muscles. We lengthen it from the range of the midpoint like this. We lengthen the muscles from the midpoint without going into a fully contracted state. From the mid position, we try to lengthen the muscles. That is called eccentric strength training. For the upper extremity, we can do for the shoulder like this from the mid position, not to the full range, as much as it's comfortable, lengthening of the shoulder, lengthening of the elbow from the mid position, and similarly lengthening of the hip muscles as well as the quadriceps muscles. Everything can be incorporated using the TheraBand, placing the TheraBand in particular positions, which should be guided by a physical therapist. They'll help you how to use the TheraBand. So that helps in strength training without causing any kind of harm to the cardiorespiratory system, or without maintaining the hemodynamic stability. We can do safely the strength training under the guidance of a proper qualified physical therapist. That's very important. So now we come, along with all these musculoskeletal system and the cardiorespiratory system, now we come to the post-COVID recovery phase. Now, once the patient is discharged from the ICU, they are feeling better, or we are out of the home quarantine, still the role of physical therapist is very important in the post-COVID recovery phase, because this phase is very unpredictable. As we have seen in the second wave, all the cardiac involvements have been seen in the second wave because of the mutation of these viruses. They've become more stronger, affecting the hearts as well in the second wave. So it's very unpredictable, this condition in the post-COVID situation. In the second wave, we'll have to be equally vigilant during the post-COVID recovery phase. We cannot be reluctant, and we cannot start doing vigorous exercises by opening YouTube and see what kind of exercises we can do now. We are much better. We should constantly keep monitoring our oxygen rate to the pulse oximeter, whatever is our oxygen saturation, that needs to be continuously monitored while doing the exercises, even if we are better. Because we need to understand the people who were there in the ICU and the ITU, they suffer from post-ICU syndrome or the post-hospitalization syndrome, in which, because of the prolonged use of steroids, because of the prolonged hospital stay, they have various complications, there's severe joint pain, there's severe muscle atrophy, there's myopathy, there's sleep disturbance, and there's severe fatigue, which on top of it gives a lot of discomfort to the patients. So all these needs to be addressed by a qualified physical therapist. If we discuss it with the physical therapist, they'll be able to solve the problems with all the rehabs that we have discussed till now. Everything can be sorted, but it needs time. We have to go very slow. That is the dictum. That generally is the need of the hour in this kind of situation in post-COVID recovery phase, since it's very unpredictable. So hemodynamic stability has to be maintained once again. And while maintaining that, we need to do the endurance training. We need to do the pulmonary rehabilitation, because in 90% of the cases we have seen post-COVID, they come with pulmonary scarring or lung scarring. Now, in lung scarring, what generally we say in our general medical term, it's pulmonary fibrosis. Now, what is this pulmonary fibrosis? And 90% of the patients suffer from pulmonary fibrosis once they have come out of this situation. In pulmonary fibrosis, the lung alveoli, they collapse. We see there's lung collapse of the alveoli, they collapse, which is very common. And once they collapse together, they consolidate. So that is which gives a patchy white appearance in the CT scan or the X-ray, which we generally see in post-COVID recovery phase. That is there, which once again leads to a wide range of complications. The most important complication, once again, is fatigue, because the lung is not oxygenating properly, thereby, and at the same time, there's so much of muscle atrophy. Fatigue is very common. It is the biggest challenge being faced by most of the physical therapists these days. One is fatigue. The second one is pulmonary fibrosis. So both the situations needs to be addressed properly. And depending upon the patient's condition, we do the endurance training, functional training, gait training, strength training, pulmonary rehabilitation, which is of utmost importance in this condition. Taking care of the hemodynamic stability, we do them all. And definitely it helps to the maximum patients. They come out this problem very easily, and under the guidance for proper physical therapist with customized exercise program, even if they are not able to see physically the patients, but teleconsultations are there. We do online consultations for these kind of patients post-COVID and all, and we guide them to have a systematized exercise regime, a customized exercise regime, depending upon the problems which they have. So here I conclude by saying that definitely rehab is the mainstay or is the key for a normal, healthy lifestyle post-COVID. It's of utmost importance, as we have discussed till now, regarding the complications which come with the cardiopulmonary system, the musculoskeletal system, the nervous system, and last but not the least is the mental health of the patients, the psychosocial system. As we know, COVID has become a big stigma to our society. Isolation has become mandatory because of COVID conditions. So we can very well understand the mental health of the patient. And physical therapists being, I feel, the movement experts, they are not just movement experts, not only treating the patient physically, but mentally as well. They try to customize the exercise program and try to keep the patients motivated and positive and strong. Thereby, they take care of the emotional health as well. So they are holistic healers along with movement experts. So that is the significance of physical therapy in this whole journey of COVID-19. Earlier the detection of the disease, earlier the recruitment of the physical therapists in the rehab process, the faster would be the recovery, and earlier would be the fastest would be the recovery, and at the same time the complications can come up can be taken care of by the physical therapist, qualified physical therapist, very easily. So earlier detection, earlier diagnosis, earlier involvement of the physical therapist is very essential in COVID conditions for the proper rehabilitation, which is very important. And there lies the beauty and the significance of physiotherapy in this whole journey of COVID-19. Thank you.
Thank you. Thank you so much, doctor. That was really insightful, especially the vapor part. I mean, we usually do that when we see somebody, suggesting us that you also should take vapor. So that
Yeah.
was really insightful. Thank you so much. So now I would like to call Mr. Ranendra Ojha, Marketing Head, Surite, to speak a little on Surite and how we can help improve healthcare system in India.
Thank you, Tanya. Dr. Thamina, thank you very much. That was a very, very enlightening session for all of us, I'm pretty sure.
Thank you.
And I'm pretty sure there'll be a lot of people wanting to ask you a lot of questions. So I will not take a lot of time. I just want to introduce Shurite to the people here because I'm pretty sure to most of the people who are participating here, this is a very, very new name. They have not heard about us in the past. So, just very quickly to tell you about us, we are actually a very young startup. We are essentially a technology-driven digital healthcare aggregator. What essentially we do is, just to kind of give you an idea about Shurite, because for you to understand, all of you to understand. See, there is a lot of need what we talk about in terms of allied healthcare services in this country. For example, a person like Temina, the kind of stuff that he talked about. A lot of us have no idea, and we don't even know if we had to do something, where would we go? And something very interesting. As this call was going on, I got a urgent request from somebody regarding portable X-ray. Now with the COVID, people are asking for portable X-ray. Where do you get portable X-ray? I have no idea. Except for the fact that with Shurite now I know where I get portable X-ray. So the idea about Shurite, the idea behind Shurite is to provide a seamless healthcare services aggregation. You need any diagnosis. So people know about doctor consultations and diagnostics, but beyond that, what? So you need portable X-ray. You need a physiotherapist to come to your house. You need a physiotherapist to do some sessions with you. You need some devices. Where do you? Tomorrow, if somebody needs to get a wheelchair, where do you buy a wheelchair, or where do you rent a wheelchair, and these kind of things. So that's all that Shurite is all about. We basically look at that, and basically the idea is to use this aggregation to reduce your overall cost of healthcare. Because while insurance takes care of only about 45% of healthcare needs, uh, there is a lot of other healthcare needs that you have and you don't know. And as a result, since you don't know, uh, people take you for a ride. Surite helps you in being more aware about it, getting the right information, and getting the right value for whatever money you spend. And that's what Surite is all about. What I will do is I will just put our website and call center number in the chat box. And this is not a marketing forum for Surite, so I will not talk more about Surite here. I'll just put it on the chat box. I would request all of you to go to the website. You can actually download the app, whether you have an Android phone or a iPhone. You can download it from the Play Store or the App Store, and you can see for yourself and see whether you can benefit out of it. That's all about it. I think people would now like to ask any questions to Dr. Kamina. I'm also available for answering any questions that you might have for us. Tanya, please take it away.
Yes, thank you so much, Mr. Ojha. Uh, we are now open for question answer. If anybody wants to ask anything to doctor, can ask.
Irene, can you help us? I think the attendees.
From the participants, if anybody wants to ask, please raise your hand or you can put your question in the chat box or in the question answer. Irene, is there any question from the attendees?
No, I don't think so. I don't think so. No one has written anything in the chat box, actually.
You
Okay.
can ask your questions in the chat box if you want.
Yeah. So if anybody wants
I
to
think
ask
there are
any
some.
question,
There are some questions. I think one is what is there's somebody, Mr. Manas Day is asking what is a therapeutic band? Dr.
okay,
Tamina,
yeah,
there is.
yeah, on the question. Yes, what is therapeutic band, right?
Therapeutic band.
Yes, yes.
Yeah.
What is a therapeutic band?
Therapeutic band, generally we have these kind of bands like from TheraBand. It's a company, it's a brand name, TheraBand, from which we get these kind of resistive bands. Like depending upon the color, the resistance change. Like we have yellow bands, which are minimal resistance, which can be, that means we can do the exercises easily. If we have more of weakness, we can do easily with these kind of bands. But if we have more power and we want to improve the strength even further, from the yellow, we can move on to red. With the change of color, the resistance also increases. Like red is more than, the strength of red band is more than yellow. And then green is more than red. And then blue is more than green. And then black is more than blue. So depending upon the strength of the patients, we generally assess the patient's strength, and accordingly we decide what kind of color is used, would be needed by those patient to improve the strength of the patient. So that's the TheraBand or therapeutic band.
Basically like the karate belts.
Yeah, mostly like that. And then mostly the color has to be assessed by the physical therapist, like which color is like suitable for the patient to do the strength training. So that's therapeutic band.
There is one more question on slightly off topic, but
Osteoporosis, yeah.
yeah,
But this is
physiotherapy
not
methods for
relevant for
osteoporosis.
this. This is not
Yeah, not relevant
okay.
right now. Osteoporosis,
Relevant
yeah,
right
if you have bony weakness and all, you need to do strength training. More of we use our own body weight to do strength training in those kind of conditions. Like I think we should take some other webinar on that osteoporosis later on, maybe.
Probably,
This is
yes.
not the ideal
Sure.
platform right now.
Yes, absolutely. Okay, I don't think any more questions are there in the chat box.
Yeah,
Yes, I think there were two questions.
So, so we come to the end of this session. May I request Dr. Richa to just give the sum up?
Hi. So I think thank you, a big thank you.
excuse
Dr.
me, I think there is two more questions actually. There is a gentleman called Prabhat Kumar who's raised his hand, and there's a question which says, "What is postural drainage?" I'm sorry to
Postural
interrupt you,
damage.
Dr. Richa, but
Yeah.
two questions came up.
Like postural drainage is a position which we use generally to clear our lungs. The sputum, if there's a sputum or mucus adhered to the lung walls, then we try to use the effect of gravity to improve or clear the lung function. So we try to expel the sputum by taking the use of gravity. Suppose our left lung is involved, with the left side of the lung is involved. So we need to keep our left side of the lung uppermost on the top by lying down towards the side and we try to use the gravity, then the gravity also pulls the sputum down, the mucus down, and we then use the active cycle of breathing technique so that the sputum can be expectorated out easily through that particular area of the lung. So that is postural drainage, where we drain the mucus, taking the help of gravity in particular positions where the mucus can easily be drained out from the lung and thereby making the lung airways clean. So that is postural drainage, where we use the posture to clean our lung airways.
And I think there is an attendee, Mr. Prabhat Kumar, who raised his hand. Maybe he can ask his question. And herein,
Anindita, if you can allow him to speak.
Yes, to unmute himself.
Yeah, Prabhat Kumar. Yeah, please unmute yourself, Mr. Prabhat Kumar. Yeah. Ask your question.
That's all right. Now I can understand the thing. It's okay.
okay, all right.
Any other question? Anything else?
No, I think
I
that's
think we
Yes,
have
there is one more question.
Yeah. What is nerve pain and what are the symptoms of nerve pain?
Yeah.
Nerve pain, generally, if we have any kind of nerve pain, it will be a radiating pain along the nerve root. So if it's a radiating pain, then it's very easy to understand that it's a nerve pain. Along with nerve pain, we can have a tingling sensation, which is again a sensation of the nerve. We can get numbness, which is again a symptom which tells us there's a nerve root impingement or entrapment. So that's how the symptoms tell us that there's some kind of impingement in the nerve root because of tingling or numbness or any kind of radiating pain down the extremity, where it can be an upper extremity as well as lower extremity. Now, the cause has to be assessed and found out, what are the situations in which the nerve is getting impinged. So depending upon that proper assessment, we need to find out like what is the reason of the entrapment, and then we can sort it out how it is to be resolved, depending upon the condition.
Okay.
We have one more question from Ms. Anjali Sharma. Why is lymphatic drainage so important and how does it affect our health?
Lymphatic drainage is an important part of our immune system. That's why it's very important. Lymphatic drainage generally, once, especially it's a little bit cancer-oriented question, like lymph nodes are being, as we know that it can travel the cancer if we are having some kind of operation for the cancer and all. Generally, at times it travels to the lymph nodes as well. The lymph nodes gets blocked in cancerous patients. So once they are trying to remove that particular organ which is affected by cancer, at times the lymph nodes are also being removed. If the lymph nodes are removed, then automatically the lymph drainage does not happen properly. We get lymphedema because the drainage is not happening properly. And that's the reason the lymph drainage has to be done by manually. Physical therapist helps you to do the lymphatic drainage, which is very important. Otherwise, if the toxicity remains in the body, then we have many other ailments. So that's why lymphatic nodes, if they are cut, we have lymphedema, which needs to be drained at proper time so that we do not get any other health ailment.
Okay. Thank you, doctor. I think we are almost done with the question answer round.
So over to Dr. Richa.
Yes, if you can.
Yeah. Yes, ma'am.
I would like to thank all the participants and I thank all the panel speakers. It has been indeed an engaging session. Thank you, Dr. Amin. It was very informative, very enlightening. Thanks so much. Thank you, everyone.
thank you.
Thank you,
Thank
everyone.
you. Thank you, everybody. All the participants and attendees who have joined today. Thank you very much from ICC.
Thank you.